Essentially, I am going to be talking about the challenges around managing patients with thalassemia suffering from pain. And pain is very common in this cohort of patients, whether we're talking about transfusion-dependent thalassemia or non-transfusion-dependent thalassemia patients. It's an emerging complication, often neglected and under explored when we deal patients with thalassemia, with patients with thalassemia. It is found through observational studies and from my own experience to be correlated to certain aspects, such as high iron overload, which is a consequence of blood transfusions in these patients, and low vitamin D. It's something which troubles, as I mentioned, a significant proportion, if not all of our patients, really, and some of them earlier than others in their lives. And it's a problem which significantly influences quality of life, mood, sleep, even walking ability. So this is what I'm going to be focused on during my talk about pain and thalassemia, and I'm going to make reference to certain observational studies which have been published supporting this. Well, I think people who look after patients with thalassemia need to be more vigilant about how frequent, how common the pain is, and to ask about pain in the outpatient clinics where patients are assessed on a regular basis for monitoring of development of complications from their disease. So that should be really part of what we are focused on, and so be more alert about that and incorporate this into our daily practice, and look for factors which can cause pain or aggravate pain. And often there's a lot of unknowns, and so often there aren't any particular identifiable factors which are linked to often quite significant pain in thalassemia, but sometimes there are identifiable factors which need to be looked at and addressed, such as osteoporosis, as I said, significant iron overload, early osteoarthritis, extramedullary hematopoiesis, and others. So the key messages are for the clinicians who look after these patients to be alert about this problem that a lot of our patients deal with, and which significantly, affects their daily lives. It can affect the work pattern. If they go to school, or college, they can affect their attendance at school. Because often pain can be seen in, very early in life. It can affect their relationships and their social lives and so forth. And the other aspect of addressing this issue, so by listening to your patient and by taking it seriously and looking for causes, is actually to be also ready and to have a low threshold to refer these patients to a clinical psychology service, because as I mentioned, it just, it's so directly linked to, their mood and mental well-being. I mean, you can imagine if somebody suffers from, daily pain, or for the majority of the days in a month from pain, how this can be debilitating, not only from the physical aspect, but also from the mental aspect. So, and psychology input does help in a lot of cases.